Dear students, I am Dr. Dharmendra Sharma, the Dean and the Professor and Head of Department of Forensic Medicine at the D.Y. Patil Homeopathic Medical College in Pune. In continuation of our module 1 about medical ethics, we come to our second lecture, which is about theoretical foundations of medical ethics. Our learning objectives will be, at the end of this lecture, all students must be able to understand the historical context, that is, describe the historical evolution of medical ethics with a particular focus on the Hippocratic Oath and in enduring principles of beneficence, non-maleficence and confidentiality. You may also be able to identify explain the core ethical theories and distinguish between the major ethical theories that underpin medical ethics, including deontology, utilitarianism and the virtue ethics, and also explain the relevance and application in medical practice. To also apply the bioethical principles and comprehend and apply the contemporary bioethical principles of autonomy, beneficence, non-maleficence and justice to clinical scenarios and to the decision making process. Also, by achieving these learning objectives, the students will develop a solid foundation in medical ethics, equipping them with the knowledge and the skills necessary to uphold the highest ethical standards in their future medical practice. Welcome to this session of the theoretical foundations of medical ethics. Over the next hour, we will explore the core principles and the theories that form the foundation of ethical decision making in medical practice. Medical ethics, a critical domain at the intersection of the healthcare philosophy and law, provides a robust framework for evaluating the moral dimensions of medical decisions. We will begin by examining the historical context of the medical ethics and tracing its roots back to the Hippocratic Oath. This ancient text, attributed to Hippocrates, is one of the earliest and the most influential articulations of medical ethical principles. It emphasizes the key tenets such as beneficence, non-maleficence and confidentiality. These principles have been adapted and expanded over the centuries to align with the evolving landscape of medical practice, and it continues to hold significance, relevance in contemporary medical ethics. Next, we will delve into the principal theories which underpins medical ethics, which is deontology, utilitarianism and virtue ethics. Coming to the first topic of deontology, it is an ethical theory that says actions are good or bad according to a clear set of rules. Its name comes from the Greek word deon, which means duty. Actions that align with these rules are ethical, while actions that don't are not. Deontology, grounded in the philosophical work of Immanuel Kant, focuses on adherence to the duty and rules. It posits that actions are morally right if they align with established duties and rights irrespective of the outcomes. Immanuel Kant, as the picture you can see, had an approach which was called the Kantian approach, which emphasizes the importance of following ethical principles and upholding moral duties, such as truth telling and respect for patient autonomy, even when these duties might lead to less favorable outcomes. For instance, a deontological approach would prioritize obtaining, number one, the informed consent from all the patients and emphasizing their right to autonomous decision making. Some of the key principles Deontology is fundamentally duty based, meaning that ethical behavior arises from fulfilling one's moral duties and obligations. In medicine, this translates to adhering to the professional codes of conduct, to the ethical guidelines and the legal requirements that govern medical practice. Respect for persons. A central tenet of deontological ethics is the respect of individuals as autonomous beings. This principle emphasizes the intrinsic worth of every patient in advocating for their rights to make the informed decisions about their own health care. Moral absolutism. This talks about a deontological ethics often entails moral absolutism, where certain actions are considered intrinsically right or wrong, regardless of the context of outcomes. For instance, lying to a patient is generally considered unethical under deontological principles, even if it might prevent harm. So, the patient must always be told the truth, even if you want to avoid harm. So, coming to the next principle, which is universality. Kantian deontology is guided by categorically imperative, which posits that one should act only according to maxims that can be universally applied. In medical ethics, this means that a healthcare professional's actions must be consistent and applicable to all similar situations. He cannot have one different set of rules for one and different set of rules for the other. So, application of the deontological principles in medical ethics. Informed consent. Deontology strongly supports the principle of informed consent, emphasizing that the duty to respect patient autonomy. Healthcare providers are ethically obligated to ensure that the patients are fully informed about their treatment options, their potential risks and the benefits. So, patient must be told everything about this, allowing them to make an autonomous decision regarding their care. Then coming to the next point, which is confidentiality. It means that patients confidentiality always must be maintained. It is a core duty in medical practice. Deontological ethics underscores the importance of protecting the patient information as a matter of respect for their privacy and autonomy, regardless of the potential benefits that might arise from breaching confidentiality. Coming to the next point is truth telling, which means that honesty and transparency with the patients is a fundamental deontological duty. Healthcare professionals are expected to provide truthful information about diagnosis, prognosis and all the treatment options, respecting the patient's right to know and to make an informed choice. So, everything finally depends upon what is best for the patient. The next point is non-maleficence and beneficence. While deontology emphasizes duties over consequences, it aligns with the principles of non-maleficence, which means do no harm, and beneficence, which means promote good. Healthcare providers have a duty to avoid causing harm and to act in the best interest of the patients, guided by established ethical standards. Coming to a case study about informed consent. The scenario, you can think about this scenario: a patient with a serious illness is presented with a treatment option that has significant potential risks and benefits. The patient is very anxious, as obvious, all patients are anxious and overwhelmed by the information. So, coming to a deontological analysis, the healthcare provider has a duty to ensure that the patient fully understands the treatment, its risks and all benefits. And also if there is an alternative to this, this involves providing clear, honest and comprehensive information, respecting the patient's autonomy to make an informed decision, even if the provider or the doctor believes that the treatment is in the patient's interest. They must not coerce or force or unduly influence the patient's decision. The free decision making must be left to the patient. The duty to respect the patient's right to informed consent takes precedence over the potential outcome of the treatment. Another case study on confidentiality. You can imagine a scenario, a patient discloses sensitive information about a stigmatized condition. Another healthcare professional suggests sharing the information with the patient's family to garner additional support. So, if we analyze this in the deontological way, the primary duty of the healthcare provider is to maintain patient confidentiality. Sharing the information without the patient's consent would violate their right to privacy and autonomy. Even if involving the family could potentially improve the patient's support system and the health outcomes, the deontological duty to uphold confidentiality is paramount. Now, as all things are, there are some challenges and criticisms of deontology and medical ethics, in medical ethics. The first one is rigidity. Deontological ethics can be criticized for its rigidity, as it does not allow for flexibility based on context and outcomes. Strict adherence to the rules and the duties might lead to morally challenging situations, where the best overall outcome is not achieved. Conflicting duties. In practice, healthcare providers must face the situations where the duties conflict. For instance, the duty to tell the truth might conflict with the duty to do no harm. If disclosing a diagnosis could cause significant distress to the patient. Then another challenge is the lack of consideration for outcomes. Deontology's focus on the duties over the outcomes can sometimes neglect the practical implications of ethical decisions. Balancing the deontological principles with the considerations can be challenging in complex medical scenarios. Coming to the next topic is utilitarianism, which means the belief that the right course of action is the one that will give the greatest happiness to the greatest number of people. Utilitarianism is a consequentialist ethical theory that evaluates the moral worth of actions based on their outcomes, with the guiding principle of promoting the good, the best good for the greatest number of people. This originates from the works of Jeremy Bentham and John Stuart Mill. Utilitarianism posits that it is the ethical value of an action is determined by its ability to maximize the overall happiness and minimize the suffering. In the context of medical ethics, utilitarianism provides a framework for the decision making that emphasizes the optimization of health and the outcomes for the broader community. This approach is particularly relevant in the situations where the resources are limited and the difficult choices must be made about how to allocate them most effectively. For example, in public health policy, utilitarian principles might guide the decisions on the distribution of scarce resources such as vaccines, medical equipment or organ transplantations, as we have recently seen this happen in the COVID times when vaccines were not available for everybody in the initial days. The goal is to allocate these resources in a manner that maximizes overall health benefits and reduces the burden of the disease across the population. This often involves complex calculations and considering of various factors, including the potential number of lives saved, the quality of life improvements and the prevention of future harm. Utilitarianism also plays a crucial role in clinical decision making. Physicians may need to balance the benefits and the risks of different treatment options, aiming to choose the intervention that offers the greatest overall benefit to the patient. For instance, in the end of life care, utilitarian considerations might influence decisions regarding the provision of life sustaining treatments versus palliative health care, weighing the potential for prolonged life against the quality of that extended life and the associated suffering. While utilitarianism offers a clear and a systematic approach to ethical decision making, it is not without its challenges and criticisms. One major critique is that utilitarianism can sometimes lead to morally counterintuitive conclusions, such as justifying the actions that harm a few individuals if it results in a greater overall benefit. This raises concerns about justice and potential for neglecting the rights of dignity and the individuals in the favor of the welfare of the majority. Furthermore, the utilitarian focus on quantifiable outcomes can be difficult to apply in practice, given the complexities and the uncertainties inherent in predicting the consequences of medical interventions. Despite these challenges, utilitarianism remains a vital and influential theory in medical ethics, providing valuable insights and guidance of navigating the ethical dilemma that arises in healthcare practice. Understanding and critically engaging with utilitarianism enables the medical students and the professionals to approach ethical decision making with a nuanced perspective, striving to balance the needs of individual patients with the broader goals of public health and societal well-being. Coming to, we will study a case scenario, the first one regarding vaccine allocations during a pandemic, like I was just telling you about the recent COVID one which we had. The scenario is that a highly infectious disease, example COVID, breaks out and the available vaccine supply is limited, which it was indeed in India. And in many countries, India was the country which had supplied, our government was so up to the mark that they were able to supply this vaccine to many underdeveloped countries and also to the developed countries. So, if we have a utilitarian analysis of this, the goal is to maximize public health benefits by prioritizing the vaccine distribution to the groups that most likely to benefit and reduce the overall transmission. So, that is why we saw that initially all the doctors and persons working in the healthcare field or the healthcare sector were provided with these vaccines. This might involve prioritizing healthcare workers, essential service providers and individuals at a high risk of severe illness. By vaccinating these groups first, the spread of the disease can be curtailed more effectively, leading to the greatest good for the greatest number of people. The scenario, you see another case scenario in the allocations of the ICU beds. A hospital faces an influx of patients due to any natural disaster, overwhelming the intensive care unit capacity. Now, the physicians, if we analyze this in the utilitarian way, the physicians and the hospital administrators must decide which patients receive the limited ICU beds. A utilitarian approach would involve prioritizing the patients based on the factors such as the severity of their condition, their likelihood of recovery with the intensive care and the overall impact on their quality of life. The objective is to allocate ICU beds to those who have the highest chance of benefiting from the intensive care, thus maximizing the number of lives which we need to have, which have saved, and to improve the health outcomes. Coming to the third case scenario of organ transplantation. The scenario we can imagine is that a single donor becomes available, but there are multiple patients on the transplant waiting list. So, if we analyze it utilitarian way, the transplant team needs to determine which patient should receive the organ based on a criteria that maximizes the overall benefits. This may include considerations such as potential recipients' life expectancy post transplant, their current health status and their ability to recover and lead a productive life. In short, an older person may not get the benefit if there is a younger person available with a better health condition. So, automatically the doctor needs to decide whether who gets this organ transplant. So, the younger one with a better health will get the benefit. So, by choosing the recipient who is expected to derive the greatest benefit from the transplant, the team will maximize the overall utility of this scarce organ resource. Coming to another scenario, for example, the topic is emergency disaster response. The scenario is, in the aftermath of a large scale disaster, medical teams must triage the patients in a field hospital with the limited supplies and the limited staff. A utilitarian analysis of this would be that the medical professions use a triage system to classify the patients based on the severity of the injuries and the likelihood of survival with immediate treatment. The patients with minor injuries or those unlikely to survive despite treatment may receive low priority. The focus is on providing medical care to those who will most likely to benefit and thus can be saved. Ensuring that the limited resources which are used to achieve the greatest overall health benefit for the affected population. Another scenario, cost effective treatment decisions. So, a scenario is that a healthcare system with a constrained budget must decide whether to fund an expensive new medication that offers significant benefits to a small number of patients, or to allocate the funds towards a less expensive treatment that benefits a larger population. An analysis of this would be, the decision making process involves evaluating the overall health impact of both the options. The new medication might offer substantial benefits to a limited number of patients, while the less expensive treatment could improve the health outcomes of many more individuals. A utilitarian approach would favor the option that provides the greatest total benefit, improving the health outcomes for the largest possible number of patients within the budget constraints. Another case scenario on public health policies for smoking. The scenario is a government considers implementing a strict smoking ban in public places to reduce health risks associated with second hand smoke, which is called as passive smoking. So, utilitarian analysis of this would be the policy aims to protect the public health by reducing the exposure to harmful smoke, decreasing the smoking rates and promoting a healthier environment. Although smokers might experience a loss of freedom or inconvenience, the overall benefit to the public health, including reduced healthcare costs of improving the quality of life for the non-smokers, supports the utilitarian perspective of achieving the greatest good for the greatest number of people. Another case scenario regarding prioritizing research funding. A scenario is that the research funding agency must decide between the allocating resources to multiple small projects or one large project with a high potential for significant breakthroughs. A utilitarian analysis of this would be that the decision would involve assessing the potential impact of each research funding, each research initiative rather, and the funding of the large project might lead to substantial advancements in a critical area of medicine, also benefiting many people in the long term. Alternatively, supporting multiple smaller projects could yield incremental improvements across various fields. The utilitarian approach would consider the overall expected benefits, prioritizing the option that promises the greatest positive impact on public health. Virtue ethics is an approach to ethics that emphasizes the character and the virtues of individuals rather than the rules they follow or the consequences of their actions. Rooted in the philosophy of Aristotle, virtue ethics focuses on the development of good character traits, virtues, and the pursuit of moral excellence, eudaimonia, or the human functioning. In the context of medicine, virtue ethics highlights the importance of cultivating moral virtues in healthcare professions to ensure ethical practice and highest quality patient care. Just like our grandparents taught us the value of ethics by telling us stories from the Mahabharata, from the Ramayana, stories from the Bible, the Quran, everything is told to us to become better human beings. Core concepts of the virtue ethics: virtues, so a positive character trait that enables the individuals to act morally and fulfill their roles effectively. Examples are to include compassion, honesty, courage, and humility. These are some of the virtue ethics which we all need. Coming to the next one, which is eudaimonia, the ultimate goal of human life, often translated as flourishing or well-being. In medicine, this translates to promoting the well-being of the patients and the moral integrity of the healthcare providers. The moral character, next one, the focus on developing a good moral character through habitual practice of virtues, which guides the individuals to act ethically across various situations. So, the key virtues in medical practice is compassion, honesty, courage, humility, integrity, and practical wisdom, also called as phronesis. Compassion, the ability to empathize with the patients and provide care that alleviates suffering. Compassion involves the understanding of the patient's experiences and responding with kindness and concern, a very important virtue which all doctors need to have. The next is honesty. committed to truthfulness in all interactions with patients, colleagues and society. This includes providing accurate information about the diagnosis, prognosis and the treatment options. Courage is the next one, the strength to face the difficult situations, make the tough decisions and to stand up for ethical principles, even in the face of adversity or personal risk. The next virtue is the virtue of humility, recognizing the limits of one's knowledge and being open to learning from the patients, colleagues and new experiences. Humility fosters continuous professional growth and better patient care. The next virtue is integrity, which says that adherence to the morals and ethical principles, ensuring a consistency between one's virtues and actions. This integrity builds trust and credibility in the patient provider relationship. Then the last one is phronesis or practical wisdom, the ability to sound judgments and decisions in complex and uncertain situations. Practical wisdom integrates knowledge, experience and ethical principles. Now, to apply this virtual ethics in medical practice, there should be patient centered care. Virtual ethics promotes a patient centered approach where the healthcare providers prioritize the well-being and the dignity of the patients by embodying virtues like compassion and empathy. Providers can build strong therapeutic relationships and deliver personalized care. Ethical decision making. Virtue ethics emphasizes the role of moral character in making ethical decisions. The healthcare professionals are encouraged to cultivate virtues that guide their judgment, enabling them to navigate ethical dilemmas with integrity and practical wisdom. Professionalism, which means the virtue ethics underscores the importance of professionalism in medicine by developing virtues such as honesty, humility and integrity. Healthcare providers should uphold the ethical standards of their profession and contribute to a culture of trust and respect. There should be continuous improvement. The virtual ethics advocates for lifelong learning and self improvement. As I told you earlier, that the word doctor derived from the Latin word docere, which means to teach and to learn. So, a doctor is always a teacher to his patients throughout the life, telling them matters pertaining to health and how to improve their own health, and also is a learner. So, he needs to know about the new advances in medicine. So, once you are in the medicine profession, you become a learner as well as you become a teacher. So, if you have the passion to learn, you will always become a good doctor, because all your learning and all your knowledge can help your patients to improve their own health. Healthcare professions are encouraged to reflect on their experiences, to seek feedback and to strive for moral excellence in their practice. Coming to a case study of compassionate healthcare scenario, a terminally ill patient is experiencing severe pain and distress. The healthcare team must decide on best course of action to alleviate this patient's suffering. If you analyze it virtually, ethically, the virtue of compassion guides the healthcare team to prioritize the patient's comfort and dignity. By empathizing with the patient's suffering, the team decides to implement a palliative care plan that focuses on pain management and emotional support. This approach not only addresses the patient's physical symptoms, but also provides holistic care that respects their emotional and their psychological needs. Coming to a case scenario which discusses truth telling, a patient asks about the prognosis of a recently diagnosed condition. The prognosis is poor and the information might cause significant stress to the patient. analyzing this with respect to virtue ethics, the virtue of honesty compels the healthcare provider to provide truthful information about the prognosis. However, the virtue of compassion also guides the provider to deliver the news with sensitivity and support. By balancing honesty with empathy, the provider ensures that the patient is fully informed while also feeling supported and cared for compassionately. The challenges and criticism of virtue ethics in medicine. Subjectivity means critics argue that virtue ethics can be subjective, as different individuals may have varying interpretations of what constitutes a virtuous behavior. This can lead to inconsistencies in ethical decision making. Then there is a lack of clear guidelines. Unlike deontological or consequentialist theories, virtue ethics does not provide specific rules or guidelines for action. This can make it challenging to apply in complex situations where clear directives are needed. Cultural differences are there, so the virtues may be understood by valued differences across the cultures. Healthcare providers must navigate these differences and ensure that their practice aligns with the diverse values and expectations of their patients. Concluding this topic, the virtue ethics offer a valuable perspective in medical ethics by emphasizing the importance of a moral character and the cultivation of virtues. By focusing on the development of qualities such as compassion, honesty, courage and humility, healthcare professions can now provide ethical and high quality care that promotes the well-being of the patients. While it presents certain challenges, virtue ethics complements or ethical frameworks, other ethical frameworks, and contributes in a holistic approach to ethical decision making in medicine. By striving for moral excellence, healthcare providers can enhance their practice and contribute to a more humane and ethically sound healthcare system. Revising all what we have taken in this lecture, the principal theories which underpin the medical ethics are deontology, utilitarianism and virtual ethics. Thank you.